Okay, here is my lower body neuro assessment. It's a little bit difficult with the angles in the video, but we're going to do the best we can. I'll try to verbally explain as much as I can as well. So we're going to begin by reassessing this patient's orientation because earlier he could not remember the date. So I would ask him the date again and see if he remembered earlier, just to reassess the orientation of the date. So now I will start with the gait, and Rod, I would like to see if you could turn around and walk for me. That way, walk over and back. I would be paying attention to his gait, symmetry, balance, and all that. Go ahead and stand right there. Now I'm going to have you walk. Go ahead and actually step back. Go back, back, back. Now you're going to walk to me with, like you're on a tightrope. Foot in front of foot. And I'm going to assess his balance. Go ahead. Foot. Great. Go ahead. Now, I'm going to have you turn around and you're going to walk on your heels. Go ahead and walk on your heels. Okay, now turn around and walk toward me on your toes. Great job. Okay, stay right there. And now I'm going to have you stick out, oh my gosh, stick out your hands. And you're going to, with your hands up in the air, like this. There you go. Now I want you to go ahead and close your eyes. With your feet together, eyes closed. And I would perform this for 60 seconds or a minute. And assessing the balance and stability. Okay, go ahead and open your eyes. Now stand normal. I'm going to hold my finger up. You're going to touch your nose, touch my finger. Touch your nose, touch my finger with both hands. Go ahead. So touch your nose. And then touch my finger. Touch your nose. Touch my finger as fast as you can. Great. Now the other side. Perfect. So I'm going to place something in your hand, and I want you to tell me what it is, okay? So open your hand, close your eyes. Bad patient, he's tired. So I'm going to place something in your hand, try to feel around and see what it feels like.
Cotton ball.
Excellent. And then we do it with the other hand. And then now try to tell me, sorry, that's my dog snoring. Try to tell me what I'm, Tank, no. Okay, try to tell me what, close your eyes and I'm going to draw something in your hand. You're going to try to guess what I'm drawing. Can you feel it is numbered?
3.
Great.
3.
What was that?
Straight line down.
Okay, perfect. Okay, so now we're going to do upper body strength. I'm going to hold your, okay, and you're going to try, go ahead and pull your arm up. Like, try to go against me, pull it up. Okay, now push it down. Perfect. Give me your hands and grip my 2 fingers. I'm going to be doing this all bilaterally too. I know that. I'm just trying to keep the video down. Squeeze as hard as you can. Perfect. Now with your thumb, can you bend your thumb like that? Like this? And try to push up on my thumb. Perfect. And this one? Go ahead. Good. And I'm also going to be comparing side to side. So the lower body is a little bit tricky because to show you on the video. So I'm going to try to reposition it. Can you lay down? So I would be performing abduction and adduction strength. Go ahead and put your feet up. So I would put pressure, or I would put some resistance on the side and have them go ahead and try to open your legs, which would be abduction, and then I'd put them in the middle and try to go ahead and put your feet together, and then that would be adduction. And then I will have him dorsiflex. Go ahead and press like you're pushing on the gas, and then flex up. Perfect. And then assessing obviously the sensation or the Babinski, I would pull up, and he's extremely ticklish. So I would check for that. And I would again do it bilateral. So now we're gonna have him sit up. Can you sit up for me? And we're gonna do the assessment of sensory assessment. We're going to do tactile and pain sensation. So we're gonna check on the upper body. Tell me if this is soft or dull or sharp.
Soft.
Or soft or sharp, sorry.
Soft.
Okay, and then this side?
Soft. 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 Soft.
Okay.
Sharp. 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 Sharp.
Okay, and then you can also check the fingers too, and some of the assessments that I saw, it showed checking, you know, the thumb for dullness or sharp.
Sharp.
And then we'll check the lower extremities on the inner or on the thighs. So again,
Sharp. Soft.
and then we would do the this would be
Soft. Sharp.
assessing both sides, and then also the toes, we can poke at the bottom of them as well, checking if they can feel, you know, sharp and ticklish. And then we can also do the vibration test with our equipment here, and we could activate it and then see if they feel a vibration on the small toes as well. So checking that. And we can also have them spread their toes, things like that, to follow commands. Now we'll do the deep tendon reflexes. This is a little bit challenging again in the video because he's not dangling his legs enough. So I'll try, but it's basically we hit below the, I'm going to try to tilt it, below the knee generally. Everybody's a little bit different. So we would hit right here, and he would have the response. That would be the patellar. For the Achilles, you could cross them over, and then you could hit behind, above the heel and behind here for the Achilles tendon, and then you would watch for your reflex. But again, it's hard in this video. And then for here, we will do this, and I had it going earlier. It's a little difficult. But we'll be checking for the triceps. And then biceps are also a little difficult for me. This is stuff that I hope that I can still practice on. And then hitting our finger here to watch for the bicep reflex. And then I did the plantar with the rubbing up. And that should conclude the lower body neuro assessment. The best that I can do. Thank you.